Welcome back to Virginia This Morning.
This Partners in Healthcare segment is sponsored by Care Advantage. Our guest this morning comes from the School of Hard Knocks and is an advocate of compassionate care and approaching it that way. Debbie Johnston, president of Care Advantage, joins us this morning to share her story. Thanks for coming in.
Well, thanks for having me.
Care Advantage has been around. You started in 1988.
Yes, I did.
So you've been around and been providing compassionate care to a lot of Richmonders and surrounding area, and this has just grown and grown. Tell me about the company.
Well, we do a number of things. We have everything from companions to registered nurses. We take care of people with cancer. We take care of people who have been in car accidents. A lot of elderly patients that are wanting to age in their home, and just we take care of those people.
That's a wide variety, from aging in place, which is certainly a growing area that people really require care right now, or like you say, when you transition into home, and that care at the home setting is not something that maybe family or the typical caregiver is used to providing.
Right. And it's hard on families. They need help. Can you imagine working and taking care of a sick parent? I mean, life really changes when that happens.
It's true. Sometimes it's difficult enough to spend a regular day and come home and fix a dinner for everyone, let alone become that caregiver.
Right.
So you have a background. You started in nursing, and that's what prompted the ball rolling in Care Advantage.
Yes, I'm a registered nurse, and I worked at a hospital and could see people going home sicker and sooner, and knew that home care was going to be in demand. And I followed that passion, and here I have my own company doing it.
And over the years, I'm sure that you've run into or experienced a lot of families or people who have shifted into this role of caregiving that just don't know what to do after you leave that hospital setting.
It's overwhelming because you're going home fast. I learned it firsthand with my parents. My mother went home after a heart attack 4 days and needed care. And it happens quicker and sooner going home, and families are just don't really know what to do. And we are one of the answers for people when they go home, just to make it easier on everybody.
And when people find themselves in that situation, like you did with your own mother, how do you connect with Care Advantage? How do you find that resource?
Well, we're listed in the phone book. We have a web page, and hospitals know about services or outside the hospital as to who can take care of people.
Can people make that decision for themselves, or do they need to be pointed in that direction with Care Advantage? Is it a referral program for families?
They can make the decision themselves.
So that makes it a little bit more convenient, and I'm sure that you have a process to evaluate what level of care people need. They may think, well, I don't need the whole kit and caboodle, but I may need some support.
Right. We generally service people anywhere from 2 hours to 24 hours. Some people just need a bath. Some people need a ride home from the hospital. Some people need round the clock.
And this can be an ongoing, evolving relationship as well. Care Advantage may come in at the get-go, and then that continues to evolve, or maybe in some instances as people heal and are able to return, the level of care shifts.
Right. We have patients for years.
And families, I'm sure you develop a great relationship with them too.
We do.
Yeah.
We become like a family member.
Yeah.
Because we're there, like I say, for years.
And now the area that Care Advantage covers is much wider than Richmond. It's all the way down to Tidewater as well?
Tidewater, Suffolk, Emporia, Franklin, Stanton, Charlottesville.
So a pretty big footprint with a lot of compassionate care. Tell me about the Hard Knocks, if you would.
Hard Knocks is the name of, well, it's coming from my book, which is coming out Week of the Nurse, School of Hard Knocks, and I just talk about my journey, what it's been like to be a nurse. I talk about nursing school, what it was like to begin my company, and if anyone wants to read it or buy it, they can go to my webpage.
Fantastic. Well, let's let people know how to get in touch with you. Thanks for coming in, Debbie.
Thank you. Thank you for having me.
Connect with Debbie and her team at Care Advantage by calling 323-9464 or visiting online anytime, careadvantageinc.com.